I want to talk a little bit more in greater detail about absorption because that is such a key component on how we understand medications. Absorption, remember, that is the body drawing the medication into the body fluids. What affects absorption? Well, first step is how is the medication given? And it can get in the body many ways. And I mentioned a number of them. I'm going to mention a few more. And I'm going to use some different terminology. Enterally, E-N-T-E-R-L-A, enteral. That is a drug that is let's try that again. That is a drug which is absorbed into the systemic circulatory system through the oral or gastric mucosa, the small intestines, or the rectum. So, oral medication or suppositories, rectal medications. And people think, well, okay, you swallow medication, the stomach does it, but there are medications that are not swallowed. If you give nitroglycerin to a person who's having chest pain, you generally give it to under the tongue. That's called the buccal membrane, and it's absorbed through that tissue. And when it's properly, when the medication is fresh, it will tingle and feel almost buzzy underneath there, and that's good. It can also be given, or I'm sorry, that's sublingual. Oops. Sublingual is under the tongue. Buccal is a spray that would be sprayed on the inside of the cheek. That's the buccal membrane. So sublingual or buccal. Oral is swallowing it. Rectal is a suppository. They all have their different methods and different reasons for using that, but the sublingual, the buccal, get in the system really quick because that tissue, the epithelial cells inside there, absorb very quickly. Parenteral is something that's through the skin. So intravenous, intramuscular or IV, IM, subcutaneous or sub-Q, intradermal within the skin, or intrathecal in the thecal area of the spine. Those are all generally much faster acting routes because they get right in the body. They do not have to be dissolved. They do not have to be turned into a water soluble form because they already are. And those go in very quickly. Topical is through the skin from on the surface. So that fentanyl patch, eye drops, ear drops, nose sprays, inhalation. So if you take a puffer for asthma, that's actually a topical treatment because you're getting the medicine right on the spot where there's a problem. Intravaginally is another route. So the route, enteral, meaning through the oral or gastric mucosa, parenteral, IV, IM, sub-Q, intradermal, or topical. Those three routes will affect absorption. Now, if it's given orally or enterally, if food or fluid is given with the medication, that will also affect the absorption. And it will generally slow it down. If food's in the stomach, it may delay the transit from the stomach to the small intestine. That's why most drugs are absorbed in the small intestine. So if food is in there first, the stomach is going to be busy digesting food before it passes on. Now, sometimes you want food because the side effects of a medication can cause stomach upset. So in those cases, you want to prevent the stomach from breaking down that tablet too soon. But food or fluids will usually slow down absorption. There are also some drugs that are dissolved in a more acidic environment. For example, an iron tablet. Iron tablets are more readily absorbed in a very acidic environment. So how would you give an iron tablet to a person? If they can take it, with some orange juice. That extra added, that citric acid that they're drinking will help absorb that iron better. Some medications are more fat soluble, so then you would want to give it with milk. Dosage formulation, sometimes medications can be given in very small particles. And of course, small particles are absorbed easier than big chunks. Now, if the person had surgery in the stomach or small intestines, it's going to slow absorption because there's damage to the tissues. Decreased blood flow to the area will also reduce absorption. Obviously, because you want to get the medication into the fluids or blood, right? Because that's the blood then does the distribution. So if the blood isn't moving, the distribution will slow down and the absorption will slow down. And again, acidity of the stomach will affect some medications. If the stomach and the guts, the intestines, are not moving, it will also inhibit absorption. So all of these factors affect absorption and therefore the bioavailability of the medication. Remember, bioavailability, the amount of medication that can be absorbed into the system. And we've just talked about a number of ways that affect the bioavailability by altering the absorption. Okay? Gotta get to the right slide. I know, you thought I have this all memorized, don't you? Ha ha! So what affects distribution? Well, obviously, blood flow, we just mentioned. Low blood flow means poor distribution. Protein binding, drugs that are protein bound, if you have low protein in your system, that will affect distribution. So if you're malnourished, you're going to have a low albumin level, and that will affect the ability to bind with those drugs. Water soluble versus fat soluble is another one. How about medications that are using on the central nervous system? There's that blood-brain barrier, and it's very difficult for drugs to push through that blood-brain barrier to get into the CNS, the central nervous system. So water-soluble drugs enter the brain very slowly. Fast distribution. Organs that have a lot of blood supply get medications very quickly. Heart, liver, kidneys, boom. Slow distribution. Things that have very slow, much less blood supply. Muscle, and even less than that. Skin, and adipose tissue, fat cells, bones can have poor blood supplies. Although some bones have huge blood supplies. The flat bones, the sternum, the ribs, the pelvis, huge blood supplies. The long bones, much less. So metabolism. Remember that conversion to a more water-soluble drug. What organs are we looking at, and what factors decrease or increase it? Well, we talked about the biggest organ already, which is the liver. That's the main organ in terms of metabolism of a medication. But muscles, skeletal muscle, kidneys, lungs, the actual plasma within the body will metabolize some. The intestinal mucosa will transform some medications, but most of it's liver. So hepatic metabolism is a major thing, and a person who has decreased liver function will have greater chance of toxic effects, more side effects. So you got to pay attention to that. And what drug levels, or I'm sorry, what lab levels do we monitor for liver function? ALT, AST, ALK Phos, and bilirubin. When those go up, that indicates the liver is damaged, either is damaged or being damaged. Some other factors that decrease metabolism, simply age. The older we get, the less our body is able to function properly. Cardiovascular dysfunction. If our heart isn't pumping good, it won't move things around. Renal insufficiency. If our kidneys don't work properly, we can't manipulate those medications. Starvation. If If a person is malnourished, that's going to affect everything. Obstructive jaundice. That's when our liver is obstructed. That is a major problem. Genetics. Some people just are genetically predisposed to have a slower medication metabolism. A slow acetylator is a slow acetylator is people of European and African descent. So potentially many of us could have that condition. Factors that increase metabolism: a fast acetylator. Those are Japanese and Inuit descendants. Barbiturates speed metabolism, and rifampin therapy. Delayed drug metabolism results in the accumulation of drugs and the prolonged action of the effects or responses. And the longer they're in the body, the greater the chances of what? Side effects and toxic effects, not allergic reactions. So pharmacokinetics, everybody responds to medication differently. That's why I can take a medication and you can take a medication, same dose, same timing, same everything, and we will have different results because our bodies metabolize things differently. Newborns have a very difficult time of metabolizing drugs because generally their liver enzyme system is only partially developed. So a newborn is going to have a much greater chance of problems than a child who's 5 years old. And a person who's 95 years old, same thing. They will have a much greater chance of problems. And I tell you what, on that, come on back to the next chapter. We're going to talk more about metabolism and excretion.